I am Ajai. I'm a BHMS Indian. I'm emerging from Dr. Padiyar Memorial Homeopathic Medical College, Chottanikara, and doing my fellowship in homeopathic cardiology at North American Medical College of Homeopathy, Canada. And I serve as the sub-editor of Homeoshastram and the managing editor of Dirgayush Madhuri. Thank you. And today is my topic on homeopathic hepatology. I hope you all know that hepatology is a branch of medical science concerned with the treatment, diagnosis, and other modalities related to liver diseases. And the homeopathic hepatology is a new emerging branch in homeopathy that concentrating on the treatment side of the hepatological cases. And actually, it is a case series study. I designed the study as a part of my research work I have done for International Conference on Homeopathy and Phytomedicine held at St. Thomas College, Pala, Kottayam last year. Before the corona, last year in 2020, there was a huge program in the Kerala homeopathy that has witnessed. It was occurred at St. Thomas College, Pala, Kottayam. It was a 2-day international conference that has been witnessed by more than 500 people, and there were faculties from more than 12 or 13 countries from the entire world, and there were a lot of researchers. About 146 plus research papers were there, and the poster presentations were there. It was a grand program in Kerala Homeopathy in 2020 before Corona. And these were the team members of International Conference on Homeopathy and Phytomedicine. Dr. Radish Shyam, the Assistant Professor, Department of Biochemistry, was the convener of International Conference on Homeopathy and Phytomedicine. Dr. Radish sir and his team will be here in this session. And it was a research paper, a retrospective case series study on homeopathic medicine. Homeopathic management of chronic liver diseases using Andrographis paniculatum, mother tincture, and Cardos marianus 0/6. And the research was actually carried out between 2017 to 2019 at Homeopathic Multi-Speciality Hospital, Changanasheri, Kottayam, by Dr. S.G. Biju. I and Dr. S.G. Biju were designed the study, and Dr. S.G. Biju sir will join this meeting. It was a retrospective case series study on homeopathic management of chronic liver diseases using Andrographis paniculata Q and Cardos marianus 0/6, as I have said. And it was a wonderful and abstract book designed by the team International Forum on Homeopathy and Phytomedicine. It consists of more than nearly 160 research paper abstracts, and that were distributed among the participants. It was our abstract forum. Let me tell the background of this study. Let us look onto the alarming statistics by WHO. In every year, 2 million people dies of chronic liver disease every year, out of which 1 million people dies of the complications of the cirrhosis, and 1 million people dies of the viral hepatitis and hepatocellular carcinoma, which overall representing a 3.5% of all the total global deaths. In every 1 minute, 2 hepatitis B deaths are happening all under the entire world. And the liver transplantation became the second common solid organ transplantation in this era. We know that this is an era of organ transplantation. If one organ of a human body got failed, the medicine itself has a solution to transplant the failed organ. The motto of the homeopathy is to prevent such transplantations and to help those people who are suffering. And the chronic liver diseases. These are the diseases of the liver that involves the process of the progressive destruction, regeneration of the liver parenchyma, leading to fibrosis and cirrhosis. And these were the common chronic liver diseases: the non-alcoholic fatty liver disease, alcohol-related fatty liver disease, viral hepatitis, congenital liver defects, and liver cancer and drug-induced liver diseases. The purpose of this study is to find out whether there is any effect for homeopathic management on chronic liver diseases based on a retrospective case series study. To find out there is any effect for homeopathic liver diseases. Nowadays, there are a lot of questions arising from the social media. Is there homeopathy is effective? Such a lot of questions are there. The aim of this study is to find out whether there is any effect for homeopathic management on chronic liver disease based on a retrospective case series study. And to evaluate the effectiveness of our homeopathic drugs, Andrographis paniculata, mother tincture, and the Cardas mariana 0/6 in chronic liver diseases.
Excuse me, do you have screen sharing? Ajay, Dr. Ajay?
Yeah, I have already started the screen sharing.
But it is not visible.
Okay, let me check.
No, it's actually visible. It's the problem of yours, sir.
Okay.
Dr. Ajay's screen is visible actually.
Okay. Okay, the purpose of the study is find out whether there is any effect for homeopathic management of chronic liver diseases based on a retrospective case series study, and to evaluate the effectiveness of Andrographis paniculata, mother tincture, and Cardas mariana 0/6 potency in chronic liver diseases. These were the purpose of our research. And the methodology was, we have selected 30 subjects, 30 cases were selected. And the duration, 2 years, between 2017 to 2019, exactly between 2017 December 1st to 2019 December 1st. And the study area was Dr. S.G. Biju's Homeopathic Multi-Specialty Hospital, Changanasheri, Kottayam. I think the Homeopathic Multi-Specialty Hospital, Changanasheri is one of the first referral hospitals that came in Kerala Homeopathy, the first referral hospital, I think. And the data collection method was a record review. Serological markers, UC abdomen reports were studied, or those records were carefully reviewed. There were inclusion criteria and exclusion criteria for this study. The only cases that has done serological investigations, USG abdomen, before, during, and after the treatment period were only considered for the study. And the exclusion criteria were the cases without the serological investigations, USG abdomen reports, and the cases with gross ascites and malignancy were out of the study or under the exclusion criteria of the study. And there were a total of 30 cases, as I have said. There were 2 talks.
Is there any network problem? Dr. Ajay is muted.
Dr. Ajay has left the meeting. I think he has some network problem.
Yeah, of course.
Ajay is still there. Sorry.
Oh, okay.
Dr. Ajay, can you hear us?
Okay, you can proceed.
Okay, these were the given medicines. Fluoric acid given to 1 cases, and Naxomic 200 to 2 cases, and natrum sulf 6x to 2 cases, Mercurius vivus to 5 cases, and Andrographis paniculata mother tincture to 8 cases, and Cardas mariana 0/6 to 12 cases. These were the given medicines.
What all are they? Do you want to call your friends? They're almost okay. We'll call them.
And these were the results of the study, and this was the result outcome. Out of the 30 cases selected, 23 cases got cured, and 2 cases got failed, and 2 cases were on the track of improving, and there were no response in 1 case, and the other rest case 2 cases were referred. So we have got an overall of 76.67% cure rate with our homeopathic medicines, and there were 6% of failed cases with our medicines. There were some cases were given no response to treatment, and there were some cases are on the improving track, And there were some cases referred. I think the referred cases were drug-induced liver diseases. And these were the graphical analysis of the cases treated with Andrographis paniculata mother tincture or our Calmec mother tincture. There were 4 hepatitis B cases and 1 non-alcoholic fatty liver disease and 2 chronic active hepatitis cases. Out of 8 cases, 8 out of 8 cases cured. And there were 12 cases were treated with the Cardas Mariana 0/6. There were 1 single case of alcoholic cirrhosis, and there were 2 cases of portal hypertension, and there is a single case of hepatitis A and 5 cases of hepatitis B, and non-alcoholic steatotic hepatitis 1 cases and 2 chronic active hepatitis cases. The 12 out of 12 cases got cured with homeopathic treatment. And this was the discussion session on international conference on homeopathy and phytomedicine. The USG abdomen serological investigation, serum LFT immunological test all taken during and after treatment shows pathological improvement and good prognosis. The cure rate is 76.67%. That is 23 out of 30 cases were responded well or cured with the homeopathic treatment. The state of liver tissues got improved. And the hepatitis A, in hepatitis A cases, serum HBsAg became non-reactive, and in hepatitis B cases, serum HBsAg turned negative after the treatment. And there were abnormal liver function tests. They came within normal limits after the homeopathic treatment. There were portal hypertension cases were successfully managed using Cardas Marianus, I think. And the drug-induced hepatitis, the 2 cases were miserably failed. I think this section is very much important. In organ of medicine, Dr. Hahnemann says chronic diseases can be divided into 3: natural chronic diseases and artificial chronic disease or drug disease or pseudo chronic disease. There are 3 cases of 3 classification of chronic diseases, in which in artificial chronic diseases, otherwise the drug-induced diseases, Dr. Hahnemann says that there are out of scope for the homeopathic treatment. The same thing happened here. The 2 drug-induced hepatitis cases or artificial induced liver diseases cases got 2 cases got miserably failed with homeopathic treatment, and the drugs were used on those cases were Nexomic, I think. Nexomic 200. But unfortunately, the cases were failed. The follow-up investigation in all cured cases, the serum albumin and serum globulin and albumin globulin ratio every 2 months for 2 years, and gamma GT and IFP and C every 4 months for 2 years. The advancement of age, previous cirrhosis of liver damage, and persistent low baseline albumin after seroclearance is a risk factor for hepatocellular carcinoma. That means we cannot simply claim a cure case when HBsAg or HBAAG games negative. Because the advancement of age, previous cirrhosis of liver damage, persistent low baseline albumin after seroclearance is a risk factor for hepatocellular carcinoma HCC. It is an aggressive carcinoma. So the regular follow-up is necessary for the good outcome. And the conclusions we have arrived in our study was the chronic liver diseases are the leading cause for hepatic transplantation and a huge economic burden to the society. And this case series study has shown that the homeopathy has effective role in treating chronic liver diseases. The hepatic transplantation and other complications related to chronic liver disease can be prevented. The further studies required to authenticate the effectiveness of homeopathy in chronic liver diseases. Let me conclude this study is not a perfect study. This is not a final study. The further studies are invited. The further studies are required to authenticate the effectiveness of homeopathy in chronic liver disease. In our study, we have found 76.67 cases are cases responded or the cases got cured with the homeopathic treatment. But the further studies are required to authenticate the effectiveness of homeopathy in chronic liver diseases, and further studies are required to authenticate the effectiveness of the Andrographis paniculata mother tincture and Cardas Marianus 0/6 in chronic liver disease. Definitely, these 2 medicines, the Andrographis paniculata mother tincture and Cardas Marianus 0/6, will do wonders in chronic liver diseases with homeopathy. And there were some suggestions that we have put forward to the international forum for international conference on homeopathy and phytomedicine. It is one thing that the Iran needs some homeopathic specialist. That was a major suggestion, because when you have a chest pain, you directly go to a cardiologist. If you have a headache that persists for more than 2 or 3 days, we directly go to a neurologist. If you have stomach ache, we directly go to a gastroenterologist. The trend is like that. The people are running behind the specialist doctors. The specialist doctors are more concerned or more have their deep knowledge in the specialty sites. In modern medicine, there are specialists and subspecialists. I think there is a specialty cardiology. There are the subspecialty of cardiology like electrophysiology and pediatric cardiology. Such subspecialties were evolved, which demands a new era or a specialty in homeopathy also. It's a homeopathic hepatology. In the foreign countries, a lot of such specialist practitioners are specialist homeopathic practitioners are evolving. Like Dr. Ajai is practicing homeopathy in cardiology. Dr. Paul Muttathukkunnil is practicing homeopathy in oncology, and Dr. Shaji Kudiyat is practicing homeopathy in oncology without compromising the basic philosophies of homeopathy. That is the this era need homeopathic specialist. We put forward a need of a new branch, a homeopathic hepatology that I have first mentioned in my slide. And we have ample scope in cardiology and ample scope in chronic liver diseases that I have studied. I got my these things are I got after my research works in cardiology and hepatology. And there comes a new era in future 2040s. I think there is in 2040s that will be a era for specialty medical practice. This was the editorial previously have written for the Dirgayush Mandali. And few months back, the Niti Aayog had the One India, One Health system. There was a plan put forward by Niti Aayog and central government, One India, One Health system. That means in when we are approaching 2040s or 2030s, in every hospitals there will be a special wing for modern medicine, homeopathy, and Ayurveda in every hospitals. So we homeopaths get work with in ICU cases in the future. And there were a lot of specialty practices were evolving in homeopathy. Homeopathy dermatology, homeopathy cardiology, homeopathy pediatrics. Several fellowship courses and MD programs were started in the foreign countries, and some are started in our India itself. And the scope of homeopathy is in the future scope of homeopathy lies in autoimmune liver diseases. My dear friends, never ever step back from treating autoimmune cases, because when auto antibodies are found positive in your serum, there is no other option or no other way in contemporary conventional system other than providing cyclosporins and immunosuppressants in the lifelong period. But in homeopathy, we can do wonders with our the remedies of the animal kingdom and with our nosodes. So the future scope of homeopathy in the hepatology is the autoimmune liver diseases. And these were the autoimmune cases: autoimmune hepatitis, primary biliary cirrhosis, PBC, primary sclerosing cholangitis that we have found in our study. And I'm thanking God, our research paper got selected as the second best research presentation out of 146 presentators. And there were this was a news about International Conference on Homeopathy and Phytomedicine program that was published in our Homeoshastra Monthly, and the program was inaugurated by the Ambassador of Philip Carl. And the major concern he has addressed in the inaugural session is it is to boost up the research scenario in the homeopathy in order to survive in the era of modern medicine. The major concern I have to address in this international forum for promoting homeopathy platform is that the research should be promoted in BHMS syllabus. There are a lot of concerns, there are a lot of news regarding the research from the entire homeopathic world. There are mushroom growth of research in the entire homeopathic world in the for the recent times. But the problem is that the only the MD syllabus has the only the research topic and research papers. The BHMS students and the BHMS syllabus is not very concerned on the researchers. There is a lack of research as a subject or a research as a paper in the BHMS syllabus. We have very efficient students and young researchers, but there is our universities, our BHMS syllabus is not providing research as a paper, or a research does not provide a research methodologies to the UG undergraduate students of the homeopathy. That the major concern to be addressed, and these were the references for our study. And I acknowledge Dr. S.T. Bijusa, our guide, Chief Physician, HMS Hospital, Changanasheri, and Dr. Subhadra Pai and Dr. Narayana Pai, the faculties of our Homeopathic Medical College, Chottanikara, for giving me a light to the world of homeopathy research, and Dr. T.N. Parameshwara Kurupu sir for providing me ample opportunities in homeopathy and in media, and Team Kerala Homeoshastravedi for providing all supports. And this was my research paper, and this was the session. And thank you, Team International Forum and Promoting Homeopathy for giving me this wonderful opportunity. Thank you.